Hi, I'm Rachel and I'm a physiotherapist. However, I'm also pregnant, so a lot of the things I'll be talking to you about today I've been trying to put into practice myself. I'd usually only see pregnant women as patients when there's already something that's perhaps gone awry or there's a problem. So today it's a really good opportunity for me to try and speak to you before those things have happened, to try and prevent them or give you the advice to try and help treat them yourself. Pregnancy is a time when your body changes. Some changes more subtle than others, and some that will go back to normal after your birth. However, some could potentially have more lasting effects, so it's important to take this opportunity now, while you're pregnant, to try and stop that happening. Back and pelvic pain is a very common occurrence during pregnancy. This is partly due to an increase in a hormone called relaxin, which makes your ligaments more stretchy and lax. So it means you might be extra bendy, but it's also got the potential to give you extra back pain and pelvic pain. So if we have a look at the spine, so this is the front of you and the back. So these are the bobbly bits you can feel if you run your hand up your back. Now, what can happen with your growing bump and your stretching tummy muscles, this will bring your back into an altered position. So you get an increase in strain going through your back joints and also through the joints where your hips meet your back. And then also at the front of your pelvis in this joint here, which is low down underneath your bump. So all this extra strain together has the potential to cause you some pain. So that's what we need to kind of look at next. Pain can be under your bump, between your legs and your hips or your lower back, and can give you pain all the time or just with certain activities. You might be feeling pain whenever you stand on one leg, or when you're walking, or when you lie on your side. There are lots of small day-to-day things that you can do to help prevent aggravating all your symptoms and limit the stress going through your joints. So we're going to move through to the bedroom so I can demonstrate some of those techniques now. So now in the bedroom, we'll have a look about how to get in and out of bed without putting too much strain through your pelvis. So sat down on the side of the bed, and you need to do a kind of two-stage motion here. So as you're coming down with your shoulders into a side lying position, you want to bring your feet up onto the bed and then onto your side. And then equally, as you come out of bed, try and get onto your side first, and then when you're bringing your legs down, you're pushing up through your side into sitting. Something else to bear in mind are sleeping positions. So while pregnant, you should avoid sleeping on your back, especially after 16 weeks. So ideally, try lying on your side. So we're lying back down on the bed, and you can use a pillow to go in between your knees and just give you some extra support. Now it may be that doesn't give you enough comfort, and what you want is to move back and have your leg up a little bit higher. So in this position, you're limiting the amount of strain going through your pelvis. Something else to take into consideration is how to turn over in bed. This is something that I've found really difficult since being pregnant, and it's always the thing that wakes me up in the middle of the night as it's hurting so much as I turn. So again, it's important to keep your knees together and use your elbows to dig into the bed as you're turning to send you off in the right direction. And as you bring your knees over, you want to dig back into the bed with your heels and lift your bottom. So if I just show you going one way and then back, so I'm going to dig in with my elbow, I'm going to roll with my knees together, and then as I'm going, digging in with my heels, lift your bottom and rolling over. So all the while keeping your knees together. So to get back up out of bed, again, dig in with your elbow, push down with your hand, heels over the edge, and pushing up sideways. And another benefit of that, as well as protecting your pelvis, is that you're protecting your tummy muscles from just pulling forwards out of bed. So you're looking after them as well. While we're here, we'll look at a few other techniques for everyday activities. So for example, getting out of the bath. So it might be handy to put a stool next to the bath, and then you can sit down on the stool, and then you would swing your legs over the side of the bath, and perhaps stand up into the bath, and then the same for the reverse, sitting back down onto the stool, swing your legs out of the bath, and that will just help look after your pelvis again. When it comes to getting dressed, again, make sure you sit down on the side of your bed. Rather than standing up and trying to do one leg at a time, sit down on the bed to put your underwear, your socks, trouser legs, shoes, anything like that, and then you're just looking after your pelvis again. And while we're here, I can show you how to get in and out of a car. So, coming from the car to get out, you want to bring your legs around out of the footwell and then push from the seat to come out, and then back down into the car, bottom in first, and then walking your legs into the footwell again. If you find it hard to pivot around on the seat, you can sit on a plastic bag, and that'll help just draw your bottom around, and then same for getting your legs back into the car. So ideally, just want to keep as ladylike as possible, keep those knees together. We've talked about lying positions, So now on to sitting. So when you're sitting, it's really important to think about your posture, not putting too much strain through those joints in your lower back. So ideally, sitting with your feet flat on the floor, perhaps with a pillow behind you for some extra support, or even with your feet elevated up onto a stool. And this will also help reduce any swelling that might be there. Try and avoid sitting with cross-legged, or even sitting with your legs up next to you. It's always comfy while you're doing it, but you'll soon know when you come to stand up again. And then also trying to avoid sitting cross-legged on the floor or even knelt down. So again, it's something you're going to feel when you get back up, and it's just putting in too much strain around through your pelvis. Thinking about your sitting position and posture in particular, it's really important to picture those curves in your lower back, that when you're sitting, you don't want to be slumped down and all that strain going through those joints that are already under a lot of strain from your bump and from the extra stretch of the ligaments. So you want to try and think about supporting your lower back, just drawing yourself up. So this is particularly when you're watching TV, when you're on the computer, even when you're driving. You want to just be thinking about trying to keep the centre of your chest lifted up. So you don't need to be sitting poker straight. It's not meant to be dead uncomfortable, but just rather than being in a C shape, you want to just be lifted. During the day, try and be careful of overreaching. Again, avoiding putting all your weight over to one side, and be careful of what and how you lift. So for example, if I was to come and lift my washing cushions, I would come over to the box and I would want to come in nice and close and bend with my knees so that I'm not leaning with my back. And then try and plan where you're going, so you haven't got to kind of move things out of the way first. And then feet nice and apart so you've got a nice stable base, and as you lower down, try and bend your knees and bring the box down to the floor. When you're coming back up, if you're picking something up from the floor, perhaps try and see if there's something you could lift onto in the meantime. So you'd be coming up, bringing it onto the box, and then if you can push up with your hands to give you that extra bit of support. So, and then you can come in again, lift it, and off you go. For shopping bags, this would be the classic thing when you've got all your bags in the boot of the car and it's raining and you want to try and get them all in one hand, keys in another, and make it through to the house in one go. But ideally, you want to try and spread the weight evenly. So you'd be doing a bag in one hand and a bag in the other hand, so that you're not getting all that strain through one side and off you go. So it may be more than one trip, or try and enlist the help of somebody else and see if they'll do the work for you instead. These are all common sense things to do, and easy, but easy to forget or easy to discount. If you need that bit more help for your pelvis, a bit more support, then you can look into getting a pelvic support belt from the internet. So a little bit like this one. Now this one's a little bit big, my bump's not growing quite big enough yet for this one. But you would just bring it around your body and bring it underneath your bump and attach it underneath. So it's really supporting kind of around your pelvis, and it shouldn't be digging into your bump at all. It's important you don't wear this at night time, and I would always put it over some clothing, so it doesn't have to be right over everything, but just so that you're not irritating your skin with it. Another way to help prevent and ease the aches and pains of pregnancy is regular exercise. If you exercise before pregnancy, it's important to carry on, but perhaps modify what you do. If you weren't the most keen sports person before pregnancy, then it's important to try and introduce some regular exercise that's going to help keep your body fit and strong to help cope with pregnancy, with the birth, and looking after a new baby. Preparing your body for the hard work now will help it recover after the birth. Overall, you should aim to maintain or slightly improve your level of fitness. The goal for exercising in pregnancy is 30 minutes of moderate exercise on most or all days of the week. If you're not used to exercising, you should just start with 15 minutes 3 times a week and gradually build up to 30 minutes. During pregnancy, your body has to work harder to pump blood to the baby as well as your body, and your lungs have to work harder to make sure you have the oxygen you need. So it's important not to exercise too hard. So by moderate exercise, that means exercising so that your heart rate and your breathing rate increase, but you should still be able to hold a conversation. So exercising with someone else is definitely encouraged and often much more interesting. There are numerous benefits to exercising when pregnant. These include keeping your heart and lungs healthy, keeping your weight within a healthy range, improving or maintaining posture, balance and coordination, increasing strength and stamina, and helping relieve stress. Some research also suggests that exercising during pregnancy can contribute to a more straightforward birth with fewer complications. Being a physio, I should really be a big fan of exercise, but if I'm honest, I prefer sitting on the sofa relaxing. So it's important to find some kind of exercise that I would enjoy doing. not something that's going to feel like a chore. So personally, I prefer to go for a walk, or perhaps do an exercise class where there's music to distract me and people around to make things a bit more fun. There are plenty of types of exercise that are still safe for you to do in pregnancy, such as swimming, brisk walking, aquarobics, dancing, low impact aerobics, hiking, gym circuits within reason, gym ball exercises, yoga or Pilates classes. Exercises to avoid would be those that might put you at risk of falling, such as skiing, horse riding, gymnastics or cycling on a moving bike as opposed to a static gym bike. And avoid any activities which might cause you to be hit in the stomach, such as martial arts, kickboxing or squash. You should also avoid scuba diving or exercise at high altitude, nothing too deep or too high. And it's worth speaking to your midwife to see if there are any local classes designed specifically for pregnant women. If you already have other long-term health conditions, or if you have had any complications with your pregnancy, it's important to speak to your midwife or your GP before starting new exercise, or even continuing with your usual regime from pre-pregnancy. And if you attend classes, whether that's new or if again you did that before pregnancy, it's really important to let the instructor know that you're pregnant so that they can keep a close eye on you, and they may even need to adapt some of the exercises. When exercising, you should make sure that you have flat, supportive shoes with a good grip. Remember that your bump and your extra stretchy ligaments will mean that your balance isn't so good. Warm-ups and cool-downs are a must, but be careful not to overstretch your joints and muscles. It's important to drink even more water than normal. When pregnant, your core temperature increases, and so you need to not let your body or the baby get too hot. So if you start to feel too warm when you're exercising, slow down a bit until you cool down. So wear loose, comfortable clothing and make sure you've got a good supportive bra. You should avoid doing any exercise lying flat on your back, especially after 16 weeks, as this causes the baby to put increased pressure on major blood vessels, restricting blood flow to you and the baby. Lying on your side is a much safer position for mat work. When exercising, you should stop immediately if you experience abdominal pain, pelvic pain, worsening of back pain, leakage of amniotic fluid or bleeding, shortness of breath, dizziness, faintness, palpitations, severe headache, calf pain or reduced baby movements. And don't exercise if you're feeling unwell to start with. Pay attention to your body. But apart from that, remember, exercise is a good thing. Unfortunately, a common consequence of pregnancy and birth is weakened pelvic floor muscles, causing reduced bladder and bowel control, so you might find you leak when you cough, sneeze or lift, or find you can't hold on for very long. The stretching of the abdominal muscles and increasing weight of the uterus on the pelvic floor muscles causes extra strain, and the process of birth can cause further damage and disruption. We have a look at the pelvis here, so in a seated position. You can see all the muscles at the bottom. These are the ones that help control your bladder and bowel, and you can see how much they're linked into all the rest of your pelvis. It's beneficial to do pelvic floor exercises throughout pregnancy to prevent problems, not wait for problems to occur after pregnancy. And continuing those exercises after birth will help your muscles strengthen again afterwards and prevent any future problems, especially if you plan further pregnancies. To do your exercises, get into a comfortable position, usually start in sitting. Imagine you're trying to stop yourself passing water and passing wind. Very glamorous. You need to do a kind of squeeze and lift, but without squeezing your bottom or your legs together. It's important not to do this exercise when you're actually passing water, as it can cause different problems. There are two types of pelvic floor exercises. Long ones, where you build up to holding the lift for 10 seconds, then rest for 10 seconds, and build up to 10 repetitions. And short, quick ones, where you need to squeeze for just a second, and then relax, and repeat 10 times quickly. Make sure you keep breathing as normal throughout. These exercises should be done at least 3 times a day, and are easy to fit in. And once you get used to it, you can do them anywhere while doing anything. And in fact, that's the point. You should eventually be able to switch on your pelvic floor muscles whenever you need to sneeze, cough, lift, or do anything that takes a bit of effort. Another tip is to try and minimise the inevitable constipation that comes with pregnancy, and avoid straining when opening your bowels. Eat plenty of foods with fibre and drink lots of water. And regular exercise will also help to keep your bowels moving regularly. Another benefit of exercise. Another inevitable change as your bump expands is the stretching of your abdominal muscles and widening about 1 to 2 fingers width of the line that runs down the centre of your tummy. If this widening doesn't return to normal following birth, it's called abdominal diastasis. This is more likely if you have had previous pregnancies or if you had weak tummy muscles to start with. Your tummy muscles are a big help in supporting your back, so any problem with these muscles can cause back pain and even affect your pelvic floor muscles. Fortunately, a lot of the advice to prevent and help recover from the separation of your tummy muscles is the same as how to protect your back and pelvis, techniques we've already looked at, like how to get in and out of the bed and how to be careful when lifting. Try and pull in your stomach muscles before you cough or sneeze, or support your tummy with your hands. If you do any activities while pregnant kneeling on all fours, like housework or your exercises, put a support like pillows under your tummy to help support the weight of your bump. And you should also avoid sit-ups when exercising while pregnant and after the birth, which will strain these muscles. Your six-pack will have to wait a bit longer. If you should notice any problems with your tummy muscles after birth, and that the gap between your stomach muscles doesn't come to close and you notice any bulging, it's really important to speak to your midwife, and they will organise a referral through to physiotherapy, and that's when you need to perhaps do some special exercises to help those muscles come together again. Leg cramps are another symptom of pregnancy, usually happening at night, just in case you needed something else to wake you up. Unfortunately, these can't be prevented, but if you should experience them, try and gently stretch out the muscles. For example, if the cramp is in your calves, try and pull your toes up towards you until the cramp eases off. Or you can try rubbing your calves if the stretching doesn't seem to help. You may also have woken in the night or in the morning with tingling hands, which is due to the increased fluid your body holds onto in pregnancy, compressing nerves in your wrists. This is something that usually settles down after the birth when you get rid of the excess fluid. But if it's causing you a lot of discomfort, it's important to go and see your GP and check that it is just something as simple as the extra fluid. It may be you can find some splints on the internet that will help keep your hands in a good position, and that will reduce the squashing effect. And these would just fit on your hand and they keep your hand back in position. And these are something that you would wear usually at night time, which is when the compression is often worst. Increased fluid is something that you'll notice at your ankles too, so try and keep your feet up when you're sitting down. Don't spend too long on your feet. And it's the same again, exercise will help keep that swelling down by your muscles acting as pumps to push that fluid away. All this information can be found in leaflets that your midwife will have. And with all the things covered, if you have any queries or questions or just want any more information, then do contact your local midwives, who'll also be able to organise a referral to physiotherapy. Or you can even self-refer if you feel a one-to-one assessment is needed, whether that's while you're pregnant or even after birth.